DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here. Thanks for joining me today on the show for another episode of DocTalk. Today, we're going to talk about rabies in cattle. It's something that doesn't happen very often, but when it does, you need to kind of understand it, understand the general types of clinical signs that you'll see. It's going to be a great show. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, Dr. Dan here. Thanks for coming to DocTalk today. We're sure glad that you joined us. It's been a great ride here on DocTalk, and we hope it continues. And through your support and your viewership, the letters, the hats, everything, they're very much appreciated by me. This is definitely a job that is a pleasure to work on, and I appreciate everything that y'all do for us here at DocTalk. Today we're going to talk about rabies, and when we talk about rabies, some of the things that the first thing is that we have to understand that it's part of the general central nervous system disorders of cattle, and it's one of the differentials that we'll see, but a lot of times it doesn't resemble some of the central nervous system disorders. Some of the other disorders that we see routinely are infectious types. When we have an infectious with listeria, which comes from silage, contaminated silage or poorly packed silage, we can see Histophilus, which is part of the bovine respiratory disease complex. It used to be called Haemophilus for those of us of age, but Haemophilus, Histophilus can cause issues. It can come from toxins such as lead poisoning or polioencephalomalacia, where we have too high a sulfur from distilled feeds that interferes with the thiamine metabolism in the brain, and we wind up with a polioencephalomalacia. Or it can simply come from trauma, from cattle running into a post or something of a strain in the vertebral column that causes a strain on the spinal cord. Many different things and many different causes, but the problem is cattle can't talk. So when we start to go through our differential diagnoses, a lot of times we do provide blanket treatments for central nervous system disorders. We cover the antibiotic for the potential of an infectious agent. We use thiamine for the potential of a polioencephalomalacia, and we use some sort of NSAID or dexamethasone for reduction of swelling on the brain or the spinal cord in the sense of trauma or injury. And when we get to rabies, it really has a different set of clinical signs. It has a different set of presentations that you as a producer need to be aware of in case you might think that it would be happening. Rabies is a very infectious agent from animals to humans, but it usually does not cause an infection from animals to human unless it is through saliva or some other type of bodily fluid contamination with an open sore or a puncture wound of some sort. So in general, the first thing you're going to see with clinical signs of an animal that has rabies is you're going to think that animal is choking. Whether it's a calf or a horse, you're going to start to think about choke. And choke is not in the same sense as what we would say of in a human, where it's obstruction of the airway passage. It's obstruction of the esophagus or the digestive tract. It's where those animals can't swallow. And a lot of times for cattle, the confusing one is when cows get choked on a hedge apple and they start to drool and they can't swallow. Horses will be many different things, but the old classic is the old peach pit, and the peach pit choking a horse. Another thing they'll be confused in a horse is if they're having teeth problems and they're drooling a lot. You might think that the animal needs to have its teeth floated, when in fact it could be rabid. We're going to take a break, and when we come back, we'll talk a little bit about the incubation period of rabies and more to think about here on DocTalk in a minute.
This Prevention Works Minute, brought to you by Boehringer Ingelheim Vet Medica, Inc.
Hey folks, Dr. Dan here. Welcome to Prevention Works, which is a segment sponsored by Boehringer Ingelheim Vet Medica to talk about things that you can do to promote preventative medicine from having injury and sickness in your cow herd. And I just want to talk about having a veterinarian on your farm, specifically establishing a veterinary client-patient relationship. When we have a veterinary client-patient relationship, what that means is that the veterinarian understands your operation, has seen your cattle, is part of understanding the expertise, the facilities, the geographical area, and things to make medical decisions. The second part of that veterinary client-patient relationship is that you, the producer, will use antibiotics in the way that the veterinarian has prescribed in the case that your animals need it. The veterinarian also needs to be available for follow-up calls. Get a VCPR ASAP.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey there folks, welcome back to DocTalk. I'm Dr. Dan Thompson here at Kansas State University, where I am the Jones Professor of Production Medicine here at the College of Veterinary Medicine, and we're talking about rabies. Rabies in beef cattle doesn't happen very often. Rabies in horses doesn't happen very often. But some of the things that, the wildlife that are the vectors out there in our area in the Midwest, a lot of times it's the skunk is the #1 reservoir for rabies as far as wildlife is concerned. When you get down into Texas and western United States, the coyote is the #1 vector. And then you get over into the eastern part of the United States, the raccoon. So different areas of the country, you have different, all these different species can carry rabies. But as far as the one that it's most endemic in, when you get into the upper Midwest and the high plains, we're thinking more of the skunk. And a lot of times when we see rabies in a cattle operation, it's a single animal involvement. Some of the other things that we see, such as polio or lead toxicity or things of that nature, a lot of times it'll be one to a string of cattle that will occur. But a lot of times with rabies, it's that single animal that's going to be exposed. And again, I mentioned a little bit earlier, but you start to think about, if you ever take just like a plastic bag and put out in the pen of a feedlot, and watch steers come up and sniff, and they're curious as to what that is, or put a cooler out there and they all stay away, and then slowly they start to work their way up there, and they're curious about what it is. Well, with rabies and snake bites in horses and cattle, curiosity is what gets them. And so you see this old Humpty Dumpty skunk waddling across the feed yard pen, and that steer goes up there and they start to buck and play a little bit, and they get excited about something new in there. And curiosity, they come up and they smell it, and as they're smelling it, whammo, they get bit on the nose. And same way with snake bite and horses and cattle. A lot of times it's the bite on the nose because of the curiosity of them coming up to see what this is. Again, when you see the clinical signs of rabies, you're going to confuse it with choke in cattle or choke in horses or dental problems. And a calf that has choke will be slobbering, it will have lost weight, it will not be swallowing, not be eating feed, will not be drinking water because it has a plug. Most of the time it's a hedge apple at the thoracic inlet, and a lot of times we can poke those on through with a Kingman tube, which is a 2 3/8 inch orogastric tube that we run down there and poke that hedge apple on through. The incubation period of cattle is 15 days, and once they start to show, from the time they're exposed until they start to show clinical signs. So if a steer gets bit, it'll be about 2 weeks until you'll start to see the clinical signs of rabies. And then the mortality, days to mortality, once they start showing clinical signs, is around 4. So a steer that has rabies will show clinical signs for 3 to 4 days and then die. The incubation period in sheep, for those of you who want to know about sheep, is 10 days, and it's about 3 days from the time they show clinical signs until the time that they will perish from rabies. It is a terminal disease, and when we come back, we're going to talk a little bit more about what you should do if you think your cow has rabies and if you've been exposed. You're watching DocTalk.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrix colostrum supplements. Colostrix is USDA licensed and proven effective. When your money is on the line, trust Colostrix.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
All over the country, more and more communities are making the change to biodiesel made from U.S. soybean oil, and the decision continues, improving the health and welfare for millions of Americans while adding billions to our national economy.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey there, folks. Welcome back to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University talking about rabies in beef cattle. And, you know, I've had a few cases in my years in veterinary practice. My dad's had a few cases, my granddad. And when they come in, they're confused with others. But when you have an animal that has rabies, a cow or a steer or a bull, you're going to have excessive salivation. You'll have muscle tremors throughout the body. These animals will be vocalizing, and I am not going to imitate the beller of a rabid steer, but you can imagine it's more of a roar than it is a beller, but they are constantly roaring or bellering, and they will continue to vocalize because they get a paresis within their vocal cords, which makes them sound different than a normal beller. But there are two ways that rabies show up in animals. There's the furious form and there's the dumb form. And the furious form is it's kind of the Cujo deal, right? Where they're slobbering and they're aggressive and they're going to bite you and they're going to pass that rabies on. The dumb form is just what you'd think. It's an animal that just goes and lays down, or one that is non-responsive. 80 to 90% of the time when cattle get rabies, they present in the furious form. And this will come with hyperexcitability, muscle tremors, saliva. They're going to try to kill you, chase you up fences, and very, very aggressive. They beller and they have a roar, a constant bellering, and you'll hear the old timers that had a rabid cow that got bit that is bellering all night in the barn, or the bull that is acting like it's choked on something. And the first thing, your first response is there's something caught in its throat and I'm going to help them get it out. Well, this is where you could be exposing yourself to rabies, okay? But most of these are going to have some sort of furious form. And when you see an animal with rabies, a lot of times you're sitting there, if it's one that's just slobbering, head down, depressed, you're not going to, it's more than likely a choke. Animals with rabies do exhibit a high rectal temperature. Animals with choke don't. So getting an animal that you see, a single animal that's got excessive saliva, it's time to get the veterinarian involved. Bring them out. It's probably just a choke, but let the veterinarian come out. Veterinarians have been vaccinated for rabies. They've gone to school and they've seen the rabies cases, and they can put your mind at ease. Don't try to guess and think it is or think it isn't. Just get that second opinion, get the veterinarian on the farm, take the animal into the veterinary clinic. But when we start to see these animals, obviously they're dangerous animals. And if you do euthanize that animal, make sure that you take the whole head and take that head to the diagnostic laboratory so that you can get it tested for rabies. There's no other test available. We can't do a live animal test for rabies. So one thing that when we talk about euthanasia of cattle, a lot of times we use the landmarks, of somewhere on the skull, and we're going to make sure render that animal unconscious through captive bolt or through a gunshot to the brain. We can't do that and still get a diagnosis of an animal that's suspect of rabies. So either have the veterinarian euthanize that animal, or we need to use a different method of euthanasia. A lot of times that is a heart shot with the gunshot to get that animal to the ground so that we can get the animal in and use the diagnostic lab to get the proper diagnosis. When we come back, we'll talk a little bit about the next steps if you think you've been exposed to rabies. We have an extremely good system in place, and people don't die from rabies exposure these days. Thanks. We'll be back after these messages.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We are Mike and
Martha
Armitage here at the A-Bar Ranch, Claremore, Oklahoma. We're a unique operation. We both have a background in agriculture production. Strong believers but the unfortunate thing is, many of you know, the transition from generation to generation can be extremely difficult. And now we've also got the Beef Checkoff program as a leader in helping that transition of generation to generation.
As somebody who has been through a generational passing and will go through with his family in the future years to come, I know how important it is that we take our money and we invest it in the right places. And so that $1 gives us so much for our return on our investment. And so I'm excited that what the Beef Checkoff has to offer in terms of promotion and marketing, what it will return to us in the future.
You know, now that we have a child and we have this ranch and this incredible opportunity to further our lifestyle rooted in agriculture and then pass that on down to our son.
The future of agriculture is dependent upon this, our youth that are coming along, and the average producer is in the 50s. And so we're going to have a big transition within the next 10 to 20 years of all these ag lands, and we find it extremely important that we have the right leadership and we enhance our ability to transmit these ranch lands and these cattle operations to the next generation.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here at Kansas State University. We're talking about rabies in cattle. So how can you get rabies? And I think that's the first one. Somebody said, well, were you exposed? Well, what the heck does that mean? Well, exposure means this. Most non-bite exposures are to rabies. Those aren't considered exposure, okay? We've got to come in contact with blood, saliva. So it's got to be our blood with their blood, saliva to our blood. So anytime we have that's the reason why you need to wear Band-Aids over the tops of your wounds when you're working with animals and different things to that nature. But blood, urine, feces, saliva are all different types of bodily fluids that you can become exposed. Very rarely is it aerosolized, where you would inhale it from their sputum or from their breath. But open wounds with saliva and bites are the two biggest ones. And if you've been handling the animal, we would consider that exposure. The first thing you want to do is go in and wash your hands with soap and water, okay? We want to capture the animal, and we want to either submit the whole animal or submit the animal's head for diagnosis. If the animal comes back positive for rabies, it's that point in time that you want to contact your veterinarian and anybody else that was associated with that case, okay? Or the veterinarian will call you and say, hey, we've had rabies. We want to take extreme precaution. Whenever you see that type of animal, don't have the kids out there and working with them, or elderly people that are immunocompromised. So the first thing we're going to do is we're going to contact the public health office, and they're going to determine the type of exposure in which you've had. And based on the type of exposure, then we have set protocols and post-exposure prophylaxis, which could be, one thing I want you to know is we don't have any vaccine failures in the U.S. if this is delivered and reported promptly, okay? One dose, sometimes depending on where you're at in the exposure from rabies, that might be a dose of an immunoglobulin, which is the antibody already formed that will go in and neutralize the rabies virus. And then you will be vaccinated for rabies, which could be 5 doses over a 28-day period. This isn't the old, remember the 28 shots in the stomach type thing. This is a 3 to 5 vaccinations in the rump over a 28-day period where you're vaccinated and then you build up a titer. All of us that go through vet school get vaccinated twice for rabies on entrance to veterinary school, and then get our titer checked subsequently to make sure that we're vaccinated for rabies. They don't give us a little tag. Still trying to work that out. Now, make sure that when you do get exposed, or if you do, know what the clinical signs of rabies are. Call your veterinarian. submit the whole animal or the head of the animal, and once we have a diagnosis, contact the public health department promptly so that you can follow their immunoglobulin or rabies vaccination protocol. Thanks for watching Doc Talk. We're sure glad that you watch us. Remember, always work with your local veterinarian, and if you want to know more about what we do here at Doc Talk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson. Thanks for joining us today, and I'll see you down the road.
Closed captioning brought to you by AgriLabs, the perfect pairing of performance and value. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.